Alright, welcome back to the vlog. This is the second dose of April 29, 2012 here on the vlog. If you watched my previous vlog that I just posted right before this one, you may be watching this years in the future or a few minutes after I posted it or days or whatever, but I'm just going to talk like you just watched my other video and you came to this one. So, in the last one I talked about how I had done some job shadowing in the hospital for my the position that I have applied for, and it was interesting. And of course I work in the hospital. I'm a registered nurse. I work on the inpatient units. I work in float pool, so I work on about 8 different units within the hospital. I just call before I go into work, and then they tell me where they need me to work to help them out, or if they just want me to float all over the hospital and help with admissions and medications and things like that. So the job shadowing that I did, well, normally I'm a staff nurse, which means I work on the floors, the units and all. But the job shadowing that I did was in bed management, for a bed management coordinator position. And what a bed management coordinator does is pretty much what it sounds like. They coordinate the beds, and they manage the beds within the hospital. But that's not all, of course. As with anything, it can't be that simple. There's a lot of switching around, a lot of communication with physicians and house coordinators and things like that. House coordinators are a different position, of course. But what they do is they have their own little office. Talking specifically about where I work. But they have their own little office and their computers, and they have a big screen that shows every unit within the hospital and how many beds are full on that unit, how many are open, and what percentage of capacity they're at. And they do that for each unit. And of course we have to monitor how many telemetry beds there are, because that could limit where we could place a patient if they need telemetry or heart monitoring. So I did that. So the ER is right there. They'll want to admit someone. They'll bring paperwork to the bed management coordinator, or BMC, and they will look through that patient's chart, look at their vital signs, their lab work that they had done, EKGs. They may even need to talk to their nurse taking care of them to find how ill is this patient that needs to be admitted, to find out if they need to go to a higher acuity unit, or if they can go to a general medical or surgical floor or the orthopedic floor, which one they should go to. Do they have kidney failure? If so, then they'll go to the renal floor if there is a bed. So they have to look through the paperwork. They have to find out what kind of insurance they have to decide if they have to run them through a system to see if they qualify for inpatient status or observation status, things like that. So they have to determine the acuity of the patient and decide if they're going to be an inpatient or observation patient. And then call up to the units and tell them that they're going to be getting an admission, and maybe get some grief from the unit about getting another admission. And that's that side of it, basically. The other side is there are other facilities, since the hospital that I work at is a bigger facility than a lot of the small ones that surround us. And those ones, when they have patients that they don't have the capability of caring for, that needs certain surgical services, or just needs more specialists to be on the case, they will call into the BMC and tell them what patient they have. The doctor actually calls and talks to the BMC and explains what's going on with the patient and what they feel needs to be done, and could we try to get a physician at our facility to accept this patient and take them into their services. So it could be anything from obstetrics to surgery, whether it's orthopedic or general, or GI, gastrointestinal, stomach and all that sort of stuff, or whether it's cardiologist, or if it's the hospitalist, just the medical doctor that is in the hospital 24 hours a day and takes care of all the general medical issues, things like that. So, and then we'll have to call whoever's on call for that specialty, like cardiologist, have to call them up in the middle of the night, the one that's on call, wake them up if they aren't already awake, tell them what the other facility and physician has called about, tell them all about the patient and all their labs and vitals and how stable they are and whatnot, and see if they'll accept any other services, and go back and forth until we can reach an agreement. Or if no one will accept them, then tell them, sorry, these physicians feel that they should go to an even higher, bigger facility with more capabilities. So basically that's it. I know this may have been boring, but if you really want to know the other side, another side, not the other side, but another side of nursing, that is one. So just facilitating that, it's a big thing. So I'm looking to maybe try to get into that, switch things up a little bit. So, alright, hopefully this hasn't been too boring. Hopefully it's been informative for you. Maybe I'll talk about other sides of nursing at another time.